Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. We've got Dr. Phil Chan. He's a leading physician in the state of Rhode Island. He joins us weekly to talk about different important health issues that may be impacting you or your family. Dr. Chan, thanks so much for joining us.
Thank you so much for having me.
So let's talk about kind of an emerging health issue. It's certainly a big policy change here in the state of Rhode Island. A couple of years ago, legalized the use of cannabis, marijuana, ganja, whatever your term of choice is, for personal use. A big change in public policy. Used to be a criminal event. Talk a little bit about what you've seen just since the passage of it, and from a top line standpoint.
Sure. So cannabis, which we often also call marijuana, slight differences. Marijuana refers to the active ingredient in cannabis, THC. But cannabis and marijuana are the most commonly used drug, one of the most commonly used drugs here in the United States. And as a primary care physician over the last decade, I've had a lot of my patients report use and ask me about prescribing medical marijuana as well. So it's definitely something that's really common in Rhode Island and all over the country.
And have you seen, plus and minuses? What have been the impacts?
So, I think about cannabis similar to tobacco in terms of smoking. From my perspective as a physician, if someone has a joint every once in a while, once a month, even once every couple weeks, it's probably not a big deal, right? The problem with things like tobacco is the constant smoke, the constant chemicals and additives that your lungs are being exposed to. If you're smoking a joint every once in a while, you're not exposing your body or your lungs to the same amount of chemicals and harmful effects as if you were smoking tobacco every day.
Sure.
Now, that being said, I have had a few patients who smoke a lot of marijuana, and that can be a problem over time.
And then the other delivery systems, edibles and inhalants of them. What are you seeing there? Is there any kind of macro factors that are beginning to emerge?
I do think that edibles are a little bit better, say, than inhaling smoke into your lungs. The problems with edibles is that sometimes the concentration of the drug can be all over the place. You may not know how much you're consuming, and people can certainly consume too much THC, too much marijuana. And what really becomes a problem over time is if people are becoming really addicted to cannabis. So in the medical profession, there's a term for this called cannabis use disorder. And about 3 out of every 10 people who use cannabis or marijuana fall into that category. And what that means is that people really have trouble controlling their use of marijuana to the fact where it's affecting their life. They're craving it, they can't cut down, and it's really affecting different aspects of one's life.
And when you say that 30%, how are you, if folks are bringing that or you're seeing it when you're interacting with patients, how are you counseling them on this?
So exactly as I mentioned before, I tell people that occasional use of things like marijuana are probably not harmful to one's health. There's pretty good evidence that the more that people use, the more that they have in terms of harmful health effects. There's definitely an increased risk of heart attack and stroke. In fact, this is relatively timely in that just last week, a big study was published indicating that folks that do smoke marijuana have a significantly higher risk of heart attacks and strokes. And we also know, especially in younger folks, people that are under 18 who start using marijuana, is that they are more likely to be addicted and they are more likely to experience different mental health disorders. So I generally do discourage younger folks, and certainly folks in adolescence under 18, really try to discourage their use of marijuana.
Let's talk about some of the benefits. Obviously, medical marijuana has been widely prescribed for a significant period of time, and those who suffer certain maladies say, oh my God, it was the only thing that gave me any relief from the pain or the other drugs that I was taking as part of cancer treatment or whatever it might have been. Talk a little bit about that.
So I think marijuana, when used in the right settings, and certainly for medical purposes, it can be very effective. I've been prescribing medical marijuana for over a decade. It's been legal in the state for medical uses since 2006. So I prescribe it specifically to cancer patients, to HIV patients, chronic pain patients, patients with severe nausea, things like that. Marijuana can be very effective, and it can also actually, you can actually, as a physician, you can avoid other drugs, right? I can avoid opioids, et cetera. But on that note too, you do want to be careful to make sure that if you are smoking marijuana, that you get it from a reliable source. So it's also possible that marijuana, especially that bought on the street, can be laced with other drugs and chemicals, et cetera. So you do want to be careful about the source of your marijuana.
So I think it was in the 40s, might have been, there was a famous movie called Reefer Madness that sort of said you would start with marijuana and then it was the gateway drug to opiates or opium, I think probably in that period of time. Is it a gateway drug? Is there a tendency that I've become sort of emerged in cannabis, it's not giving me the same high, and there's a natural progression, or is that sort of fiction?
That's more or less fiction. And even in my own personal practice, again, having prescribed and talked to people about marijuana over a decade, I don't generally see people who use marijuana, and certainly not occasionally, progress to harder drugs.
And what's your worry about it? Is the benefits A, for health, or as an alternative to alcohol, a plus versus some of those downsides, maybe 20 or 30% of folks becoming dependent on it to some degree?
I think this becomes a question about moderation and about frequency of use. As I mentioned, I think that smoking a joint every once in a while is not going to have any major health harms at all. Similar to alcohol, if you're drinking periodically, and certainly not every day, then that's not going to have any or have minimal health effects as well. It's really when you start getting into daily use or multiple times a day, and it's really when use of really any substances, whether it be marijuana or alcohol, et cetera, start to affect the way that you function in life, your relationships, your job, and to the point where you can't really function without it, then that definitely becomes a problem.
If somebody's watching or reading this story as it gets published and is a little concerned about their own usage, what's your recommendation to them?
Please talk to your primary care provider about it. There's a lot of good people out there, healthcare professionals that can offer some support for this. And you really want to reflect and examine how you're using marijuana. Again, if you're using it periodically, once in a while, probably not a big deal. If you find yourself that you're using it every day and that you really need it to function and feel normal and you've tried to cut down and can't cut down, then that becomes a problem. And I would talk to a healthcare professional about it, and ideally your primary care provider.
As always, Dr. Phil Chan, we greatly appreciate you joining us and your expertise. For everybody else, stay tuned. We have a super busy day on GoLocal Live, and there is a lot going on in Rhode Island. As GoLocal first reported last night, the CDC under the Trump administration has clawed back $31 million. We'll be writing some follow-ups on that. That's going to have a big impact. It's going to lead to, certainly dozens, if not hundreds of layoffs here in Rhode Island. Also, we've got a big story about the mayor of Newport, who seems to run into ethical issues from time to time. He's only been in office a few months. And also, stay tuned. We've got constant updates on what's going on NCAA basketball, the transfer portal, how it's hitting URI, PC, Bryant, and Brown. Bryant coach Phil Martelli Jr. is the lead candidate to go down to Virginia Commonwealth as their new head coach, so that would lead of a void up in Smithfield. Stay tuned, keep update, enjoy this great weather. Thanks, everyone.